that affects their developing brain. And that's what we're exploring today. Joining us is Dr. Olufimilola Akinola, a consultant pediatrician at St. Ives Hospital. Doctor, welcome to the program.
Thank you very much. Happy to join you once again.
I'm happy to have you on my program, Doctor. So let's start with the basics. What exactly is iron deficiency and how is it different from iron deficiency anemia?
Um, Iron deficiency is also iron deficiency anemia
Okay.
because anemia is when there is shortage of blood. So iron deficiency will lead to shortage of blood production. So
Mhm.
it's also a type of anemia. So then what is iron deficiency anemia? It's a common blood disorder that happens when the body lack enough iron to produce normal amounts of hemoglobin. Hemoglobin is the protein in the red blood cells that lets the red blood cells to carry oxygen from the lungs to the rest of the body. So without enough iron, the tissue and muscle get less oxygen because enough hemoglobin is not produced. And it leads to symptoms of iron deficiency anemia and other um, health issues. So iron deficiency anemia in children occurs when iron levels reduce and red blood cells and hemoglobin production reduce and limits oxygen delivery to body tissues.
Hmm. Why is iron particularly important during infancy and early childhood when the brain is developing so rapidly?
Um, Iron is vital for children's brain development because it helps to make energy. It builds the protein sheet around the nerves and it supports the key chemicals that controls thinking, memory, and mood. So a lack of iron during the early growth can cause long-lasting harm to learning and focus. Iron is very, very important, in during the developmental stage, and lack of iron deficiency, it can hurt uh, a brain. I mean, the child's brain. It makes it hard to pay attention, to remember things, and it affects learning at school. And low iron changes, you know, it changes how brain cells talk to each other. This causes lasting delay in thinking and schoolwork. So iron is very, very important in child's development, especially when it comes to brain function. It helps in memory retention. It helps in school learning. So for a child to do well at school, iron is also very important.
How common is iron deficiency among Nigerian children, and which age groups are particularly vulnerable?
When it comes to iron deficiency amongst Nigerian children, I would say that iron deficiency and overall anemia They are major public health concern in Nigeria. Generally, childhood anemia affects roughly 68% of children under the age of 5, with direct iron deficiency anemia serving as the leading cause. What this means is that there are several types of anemia that cause, anemia is shortage of blood. So there are different causes of anemia, but anemia that is due to iron deficiency is a leading cause of anemia among Nigerian children. So, and it's it affects, children, most especially under the age of 5 years, but infants and toddlers under 2 years old, specifically from 6 months to 24 months, they are the most vulnerable group.
Okay, thank you very much, Doctor. The phone lines are now open. You can call us on 07000 or 09155 or 0800 You can send a text message, a WhatsApp message, or even a voice note to 08155 or 07031 to speak with our guest doctor or ask any question you might have. We are live on YouTube at WFM 917, and you can listen to us on go via our website at www.wfm917.com. Okay, so doctor, if a child has iron deficiency for several months or years, can the effect on brain development be reversed once the deficiency is corrected?
Um, when it comes to uh, uh, reversal of iron deficiency uh, in children, most of the time the effect is long lasting. So it is better be prevented uh, than waiting uh, for it to be reversed. So, so it is better to prevent rather than waiting for it uh, to be reversed.
Okay, so what are some early signs parents might notice when a child isn't getting enough iron?
Um, some of the early signs of iron deficiency anemia, the early signs are often mild, and easily you can miss it with other disease symptoms. The most common early warning signs include unusual tiredness. The patient may complain of weakness. On examination, you may notice pale skin, pale inner eyelids. Um, there is shortness of breath during light exercise, and there is cold and feet. Uh, you notice that this patient usually have low energy, usually feel unusually tired or drained even after a full night rest. Um, but over times, some of the changes that may occur after that, the early warning signs, you notice the hair and the nails, uh, they shed easily. Uh, you notice the ear shed easily. Then the fingernails uh, become weak, thin, and slightly curved, in which you describe it as spoon shaped. Um, then there is strange cravings for uh, either I mean you notice this child start having strange cravings. Either they want to chew ice or eat non-food item like chalk or clay, a condition known as pica, you know, uh, in which they start craving for unusual things, chalk, ice, sand. They also on the mouth. You also notice small painful cracks in the corner of the mouth or a smooth sore tongue. Um, Furthermore, they may also have um, restless leg syndrome, in which there is a feeling of uncomfortable creeping urge to move the leg when trying to relax or sleep at night. And um, for, I mean, these are the common signs of iron deficiency.
Hmm. Okay, so doctor, are there particular developmental stages when iron deficiency is especially concerning because the brain is undergoing rapid development?
We mentioned earlier that um, patients, I mean, children between the age of 6 to 24 months, they are the most vulnerable. It's during this period, especially children under the age of 5, it's during this period that you have brain development, rapid brain development. And we have mentioned earlier that iron is very, very essential for brain development. It helps in learning, it helps in uh, attention and retention of memory. So all this at this age is very, very important. And and it is, during brain development.
Okay, we are live on YouTube at WFM 917, and you have been listening to Radio Doctor on Women Radio WFM 91.7. We're talking about iron deficiency in children with our guest Dr. Olufumilola Akinola, a consultant pediatrician at St. Ives Hospital. Okay, so doctor, what about excessive cow's milk consumption in young children? How can that contribute to iron deficiency?
Um, Excessive, um, cow milk consumption and iron and iron
Deficiency.
and iron deficiency. Um, we notice that um, when you take iron, when you take excessive cow milk,
Mhm.
uh, there is excessive cow milk causes consumption can also result in iron deficiency. because milk is very low in iron, and it has calcium and casein block iron absorption, and large amount can irritate the gut, causing minor blood loss. So drinking too much milk can also fill small stomach, reducing the intake of iron rich solid food. So excessive consumption of uh, cow milk can affect um, iron absorption and leading to iron deficiency, because first, iron is low in milk is very low in iron. Then also the calcium and the casein in milk block iron absorption, and also the large taking large amounts can also cause irritation of the gut, which may lead to minor blood loss. So all these combined together, affect iron absorption and can lead to iron deficiency, in children.
Okay, so can recurrent infections, intestinal walls, not walls, worms, or other medical conditions cause or worsen iron deficiency?
Yes, infection, worm infestation, uh, they also affect um, iron absorption, which leads to iron deficiency. Some of these worms feed feed on iron in the gut, so they compete with iron absorption and leads to then infection, bacterial infection. They feed on iron in the, I mean in the blood. So all this cause shortage of iron that should be available for growth and development, leading to iron deficiency.
Okay. Are children who were born prematurely or with low birth weights at greater risk of iron deficiency?
Yes, children that are born, you know, uh, before the complete um, gestational age of 37 weeks, that's when you uh, describe as term, when you say a child is term. So those children that are born below terms called the preterms. I mean, they are born below the age of 37 weeks. They are at higher risk of iron deficiency, um, because before they were born, iron is deposited into the fetus when it's getting to the closer to the time of birth, which is closer to that 37 weeks completed age. But most children that are born before this 37 week gestational uh, age comes early, and most of them, the iron uh, we have not been deposited, you know, into their system before they were born. So they lack iron. So that's why for most of our preterms, incentives, as soon as they are born and they are stable, you know, we start them on um, iron supplements to be able to to ensure that they have enough iron for their growth and brain development.
Okay, so if a parent suspects their child may be iron deficient, what test would a doctor typically request?
Um, for for iron deficiency, when a child comes to see us uh, at the clinic, the first thing you do is do a proper physical examination, take a good history of this child, and from there you'll be able to know if this child is pale, and then we suspect that this child may have iron deficiency, because that's the commonest cause of anemia in our environment. So the first test is to do a complete blood count. This measures the hemoglobin, the hematocrit, to see if we have anemia, low red blood cells. And we have some tests now that gives you, an insight as to maybe this anemia, will give due to iron deficiency or not. Then you can go and do a further test if you are not able to, if you don't have a machine, that have some of these early signs, results that will be able to give that. You can do serum ferritin test. It measures the ferritin, a protein that shows how much iron the blood has stored, and is the most accurate test to check for low iron storage. Then another test that can be done is serum iron, check for serum iron or total iron blood count. This measures the amount of iron moving through the body and the body total iron binding capacity. So that is another test that you can do. Then another one is to do a transferrin saturation, wherever it's available. This shows the percentage of transferrin, which is a transport protein that is carrying iron. So these are the various tests, but most of the time, doing a complete blood count, full blood count, is enough to give a picture of if this child have iron deficiency anemia or not.
Okay. How can parents prevent iron deficiency in babies and young children? What foods should they include in their children's diet? And how can they prevent the iron deficiency, like I said, particularly during the transition from exclusive breastfeeding to complementary foods?
Um, First, we realize that breast milk, um, and even some of the complementary or breast milk substitutes, they are not very rich in iron. So for breast milk, sometimes from age 6 months, we may need to start iron supplements. Then for breast milk substitutes, some of these manufacturers are now encouraged to fortify their food. Um, the food with iron from production stage, so that these children can get enough iron. And from the age of 6 months, when you introduce uh, complementary food to these children, we encourage that gradually parents should also include iron-rich food, like lean meats, poultry, fish, beans, and dried leafy vegetables to their food to support healthy growth and prevent anemia. And it is also essential that pairing this food, the iron-rich food, with vitamin C sources such as tomatoes, oranges, bell pepper, it helps the children's body to absorb the iron much better. So the earlier will supplement with iron rich food, either supplement with elemental iron as medication, or you introduce iron rich food to their meal as soon as possible. It helps to prevent iron deficiency anemia.
Okay, so finally, Doctor, if you could leave parents with three things they should remember about iron deficiency and their child's brain development, what would they be?
Um, I want to mention that for parents, that they should know that iron deficiency is one of the commonest cause of anemia, in our children. So it is very common in our environment. About 10 to 35% of Nigerian children, comes in with iron deficiency. Then also, you should know that iron is very important in blood formation and also in brain development and growth of our children. It helps them to have good memory, have retention of what they have learned, and it is very essential when it comes to to learning at school. So it's very important, if you want your child to have good brain development, to do well at school, it is very important that you prevent iron deficiency. Then we should know that breast milk, sometimes some of these breast milk substitute don't have enough iron, so they need to be fortified. So the earlier we catch up, we are able to make diagnosis of iron deficiency in children, the better, so that we can work intentionally work to prevent it. Feed your children with iron-rich food, especially from age 6 months, when they've started taking other food apart from breast milk. This can be, you can easily Google that and see which of them that is available for you. You don't have to break bank before you provide iron-rich food for your children. So include this as part of their meals, and always pair this with high source of vitamin C, oranges, tomato, because vitamin C helps in the absorption, in the absorbent, I mean, to help to absorb the available iron and make it available for the body use.
Okay, thank you very much, Dr. Akianla, for joining us today and helping us understand the connection between iron deficiency and brain development in children. To our parents listening, remember that a child doesn't have to look seriously ill for a nutritional deficiency to be affecting their health. If you're concerned, if you're concerned about your child's growth, energy levels, concentration, development, or diet, speak with a qualified healthcare professional rather than assuming it's simply a phase. This has been Radio Doctor on Women Radio 91.7 FM. I'm Hassan Imatila. Join us next Monday for another conversation on children's health. Do have a healthy day. Thank you, Dr. Akanda, for coming to the program.
Thank you for having me.
Okay. From us at Women Radio WFM 91.7, Nigeria's first and only radio station for women and their families. It is a good morning. Do have a healthy day. Up next is the news at 12. Good morning.
Never sounded so cool.